Namaste. I am Dr. Santhakumari from Matha Ayurveda Eye Hospitals, Trivandrum. Today I am facing you to speak about diabetic retinopathy. Because the number of diabetic retinopathy patients are increasing in our country. And the people who are suffering from various visual disturbances from this dangerous disease also is increasing. I think the number is more than 75 million at present. So we have to understand something about retinopathy. Because everybody knows it is a complication of diabetes. And the number of diabetic patients also is increasing. So it is our responsibility to be aware of this disease and its eye complication, retinopathy. Okay. Now, some people ask me, Doctor, actually what is this retinopathy? Yes, it is a complication of diabetes, and in diabetic retinopathy, we can say the retina is involved. It is a condition where the microvascular system of the eye, especially retina, is involved. And retina is the most important part of the eye, and it lies posterior most part of the eyeball. Because the light rays coming from the object, reflected from the object, is focused or converging on this area. So any pathology of this retina, of course, will develop some visual problems. That is where retinopathy becomes very serious. And if not treated in time by an expert hand, it may lead to blindness, sometimes permanent irreversible blindness. So we have to avoid the development of retinopathy at any cost. And according to Ayurveda, I think almost everybody knows something about the basic principles of Ayurveda: Vata, Pitta, Kapha. These are the three elements we are taking seriously while considering a disease and its treatment. And according to Ayurvedic principles, diabetes is having a dominance of Kapha. And the reasons of development also, everybody knows, is lifestyle disorder, sedentary lifestyle, and lack of physical exercise, and excessive intake of fried items, and other cold and oily food items. And these are all basic level reasons for the development of diabetes. And the dysfunctioning of this our pancreas and deficiency of insulin. This is the basic cause of diabetes. According to Ayurveda, these causative factors are capable of increasing Kapha or vitiating Kapha. So in a way or other, we can say Kapha is a dominant factor in the development of diabetes. Then what about retinopathy? And retinopathy, if you are considering retinopathy as such, Pitta comes into the picture. And there are the action of Pitta or the properties of Pitta in the eye functioning is the formation of visual sense. Okay, so when a patient with the Kapha dominance or when a diabetic patient is having additional vitiation of Pitta, especially that of eye, the possibility of development of retinopathy is more. That is the actual pathology. And what are these reasons for Pitta vitiation? Any type of over-excitement, stress and tension is a very important point. Then exposure to bright light, maybe artificial or sunlight. For example, a patient working on mobile screens or laptop for a long time, or a person who is working in the bright sunlight, exposed to sunlight, and these are some situations. And people who are eating too much, Pitta vitiating these dietary factors. These are spicy food items and sour tasted food items and hot food items and then some deep fried, especially with masala or with spices. These are very dangerous for a diabetic patient. What happens is usually when a patient becomes diabetic, he withdraws all types of sugar contents from his diet. And instead, some people may add some other things, something like spicy and these fried items, or sour taste food items will be adding to compensate or to get taste like that. This is a very dangerous situation. These are all actually vitiating factor for Pitta. So, in concluding, I can say a patient of Kapha dominance and having diabetes, if he is taking too much Pitta vitiating factors, either in a diet form or in a habitual form, the possibility of developing retinopathy in the eye is very, very high. Okay, so this vitiated Pitta affects the vascular system of the retina. So what are the changes happening in the retinal vessels? There will be dilatation of the vessels and thickening of the walls. There may be bulging of the vessel walls, and as a result, the blood flow may be slowed down and there may develop blocks. As a result, there is a tendency of mild leakages or dots and blots of leakages. This situation is known as non-proliferative diabetic retinopathy, usually says NPDR. So this is the initial condition of diabetic retinopathy. When it progresses, the same situation may increase. It will progress again, and there will be vast hemorrhages. And as a result, lack of oxygen, hypoxic areas on retina. And then there will be a dangerous pathology happening, that is, new vessels will be, collateral vessels may be formed to compensate, to overcome this hypoxia. And this situation is known as neovascularization. This will again bleed. It is not a healthy vessels. And vast hemorrhage and clots and penetration into the inside the eye to the vitreous fluid. Like that, the complications and other pathological changes develops one by one. This situation is known as proliferative diabetic retinopathy or NPDR. If it is already attained this stage, vision will be seriously affected, and if not treated immediately by an expert hand, possibility of vision loss is very high. So whenever you feel any types of visual disturbance, if you are a diabetic patient, don't waste time. Immediately go for an expert doctor. If I'm talking about Ayurveda, there are very successful line of treatment to prevent diabetic retinopathy in a diabetic patient, also to control this hemorrhage and save your vision. That is very important. Don't waste your time. Take remedial measures or preventive measures immediately so that you can avoid being blindness. Okay. Thank you. I am Dr. Santhakumari from Matha Ayurveda Hospital.